That is regarding the perinatal risk factors. All protocol regarding the management of HIV or AIDS in pregnant women should be followed. Next is regarding the hallmarks of pregnancy. Hallmarks. What are the specific hallmarks of pregnancy we can say? First one is recognition of pregnancy, birth, menopause as normal physiologic and developmental process. The pregnancy, birth or menopause and all is not a disease. It is a part of normal physiologic and developmental processes. Advocacy of non-intervention in the absence of complications. Okay, or for all, not for all condition we have to give treatment, etc. So non-intervention methods also we can practice in the absence of complications. Then incorporation of scientific evidence into clinical practice. So always do the clinical practice with evidence-based. Okay, evidence-based practice should be followed. Then promotion of family-centered care. That is another hallmark of midwifery. And last one, empowerment of women as partners in healthcare. So the women also can take decision. They are also involving in the decision making related to their treatment or future management of healthcare, etc. These are some of the specific hallmarks of pregnancy you can say. Another one is facilitation of healthy family and interpersonal relationship, promotion of continuity of care. We are involving the family members also. We are giving more importance to the interpersonal relationship. Continuity of care is there from antenatal to delivery and after delivery care. So it is a continuity or continuous process. Okay, continuity of care is given. Health promotion, disease prevention and health education. Then promotion of public health care perspective. Public health care awareness is also important. That is also an important hallmark of midwifery. Then care to the vulnerable population, especially the elderly pregnant women, then those going through the menopausal stage, etc. Old age women, etc. Advocacy for informed choice, shared decision making and right to set determination. They have their own right, to take decision, etc. should be given importance. Cultural competence, provide culturally competent care based on cultural differences. The care what we provide also will vary according to the individual difference. Familiarity with common alternative and complementary therapy. We have seen a lot of complementary and alternative therapies. We will be studying in detail also in the 4th unit. Then skillful communication, guidance and counseling. Skillful communication, that is also a very important hallmark of obstetric or midwifery. Then therapeutic value of human presence, collaboration with other members of healthcare team. Okay, and some of the points we have seen in the first class in the standards of obstetrics as well as in philosophy of obstetrics we have seen this. Okay, it is one of the hallmarks of midwifery. Regarding the contemporary issues in obstetrics, usually the reproductive implication of medical illness. Suppose a pregnant woman is having the associated medical complications. What may be the outcome of the pregnancy? There may be some maybe we feel some issues, contemporary issues. How we can go in liaison with other medical professionals. The process of deciding whether to continue a pregnancy if it is known to carry a genetic risk. Suppose the fetus is affected with genetic abnormalities. What we have to decide? Whether we want to continue the pregnancy or to go for medical termination of pregnancy. The intrusiveness of certain options for dealing with infertility, that we have seen in detail in the ethics of infertility. There are a lot of infertility treatment. Again, that will be creating some issues. Paternal expectation for a perfect baby. Parental expectations for a perfect baby. If anything goes beyond that, they will not be in a situation to adjust with that particular situation. I mean, if the baby is having any congenital health problems or any other diseases, that will be out of their expectations. So how they will be dealing with that condition. So the difficulties some traditional practitioners experience in adapting their practice style to changing needs of patient population. So there are a lot of alternative therapies like Unani, Homeo, etc. So how to improve their practice style according to the changing needs of population, that is also an issue in the contemporary issues in the obstetrics related to the all other departments, how we have to go in consultation with other departments, or what may be the difficulties they face in dealing with the obstetrical problems. So the last topic is the role of nurse in midwifery and obstetrics. So nurses play a vital role in promoting and maintaining health. Okay, so the nurses have to help women to make the informed choices about their care. Then the nurses must be able to give adequate supervision, proper care to the woman during pregnancy, labor and postpartum period, and to conduct deliveries on her own responsibility to take care of mother and children. And next is to promote normal birth and detect complications in mother and child. So the prompt identification and detection of complications and appropriate necessary emergency measures should be carried out. To involve in health counseling and education, teach not only the woman but the family and community is also important. To involve antenatal woman and preparation for parenthood. Preparation for parenthood is also another aspect coming in the midwifery care. So we have to prepare the parents to how to adjust or how to take care of their newborn. To promote women's health, sexual, reproductive and health and the child care. So we have to give more focus on women health, that is a role of obstetric nurse. The midwives can practice in hospital, clinics, health unit and domiciliary condition. There are a variety of job opportunities for midwives. The midwives teach and educate on prenatal care, women routine health examination, pap smear taking for preventing or education regarding the sexually transmitted diseases prevention, family planning services, prevention of spread of infection. So we have by providing education or educating the woman, we can empower the woman to manage their stress related to the particular disease condition, related to the issues of maternal health. In order to equip them to have a healthy lifestyle, the midwives have a very good role. And lastly, the role of nurse in midwifery and obstetrics can be summarized as: first one, the role of nurse as teacher or educator. We are providing lot of information, we are educating lot of things to the maternal care, infant care, postnatal care, family planning services, etc. So the role of the nurse has a role of teacher or educator. Next is nurse advocate. The nurse also should always stand for the rights of the patient, encourage child awareness, talk about their rights and responsibilities, make proper informed consent, and protect the privacy and confidentiality of the patient. So nurse advocate role is the next role of nurse. The nurse manager, nurse researcher. Nurse manager, we have to coordinate the care facilities and maintains the midwifery care standards we have to follow. Next is nurse researcher. The nurse has to participate in the research activities, conduct midwifery research, evaluate current protocols, any modification we have to bring out in the current protocols, etc. we can be find out by involving in the research. So that is nurse researcher. Then clinical nurse specialist as a political activist and as a change agent. So clinical nurse specialist, nurse, that is a particular, it's a specific role, that is expanded role of nurse. As a political activist, she implement all governmental program for MCH care, particularly in the rural areas. She keeps a track of current healthcare policies regarding the woman health. She should always update, the nurse should always update with the newer healthcare policies related to the woman. So according to that, the role can be as a political activist, always stand for the rights or health related care of the mainly to improve the woman's health. We have to stand up with the woman. As a change agent, she encourages woman empowerment. So as a whole, we are actually empowering a woman by providing all the education, stimulate awareness among women. Okay, through the mass media, through the educational program, we can give all those educational aspects.